Hey guys, Dr. Amy here with the Focus Academy, and I want to talk about reading. So a lot of you have patients that come in and the parents are saying, maybe they're coming in for this, or maybe you're just picking this up on their history, and they're saying, my child is having trouble with reading. I'm getting reports from the teacher that they're struggling, they're falling behind, they're not at grade level. Here's 3 things you have to consider that may be and commonly are a factor with reading challenges. One is, do we have a child who is more apt to be in a fight or flight or sympathetic dominant state, especially in the classroom? Maybe because they don't have great adaptability, maybe because the situation in the classroom, the multi-sensory environment, the demands socially and academically are too much and they go to that fight or flight. We have to look at that. The other thing that we have to look at and understand that's common is that they may actually have a visual motor issue or challenge. They may not be there yet with their ability to have stable and accurate tracking and movement of their eyes, to move their eyes across the page with the words. They may actually be losing their place a lot or getting the letters mixed up in their visual perception. That's a really common finding. And the third thing that's really common that we have to look at, doctors, is they may actually have some unintegrated primitive reflexes that may be causing more stress in the sit down, track with my eyes, and especially in the look at the board and then look near at a target of the letters or the visual demand, reading demand that's near and far, and this may be creating a big stress. So we don't want to just try to treat the symptom. We don't want a child to go through life pegged with a reading challenge. We want to bring our brain-based assessment, our knowledge of brain development and function, be able to have systems, communication exams that are congruent with that by knowing more about brain development, making the case for chiropractic by having exams that address underlying neurology and monitor functional brain-based changes so we can help these families in your community.